taken us slow. So I'll just start doing some basic introductions and see if anyone else turns up. So hello everybody, this is a belated Happy New Year. This seminar was supposed to take place in January of this year, but some of you will and some of you will not know that I've been very, very ill. I had a very bad case of COVID, which turned into very serious long COVID, and I was off work for 6 months. So this is the first seminar of 2024. So we're all privileged together to be here today, and I'm so pleased that Stephanie was able to reschedule with us, although she must have thought at some point that it was never going to happen, because I just kept thinking, oh, I'm not getting any better. But here we are back at work, so everything's all fine. So we're still getting people coming in, but I think what we will do is, anyone has any burning questions about like realist work, especially if you just started, I will stay on at the end so you can ask some questions of me then if you need to. One of the other things that I'm just going to let people know is that rather organically, I've been approached by quite a lot of people over the last couple of years, and I only work 4 days a week for university. So in my 5th day, I do some consultancy. I've never really advertised this, but it's just happened. But some of the contacts that I have been working with, those projects are coming to an end. So if anyone needs any help with their realist research, whether it's regularly through a group or whether it's one-to-one for PhD students, etc., get in touch and we can see if we can help each other. I think I'm a bit of a sucker for helping people out of the realist mud. So I am really thrilled to have invited Stephanie. And like I said, we should have had this back in January of this year, but fortunately that wasn't meant to be. So this is a really interesting presentation, I think, for us at the Realist Hub because of the external links that Stephanie has with outside academia, and I think that's going to be really interesting. We've got another talk coming up next year as well in January, which again will be based around third sector organisations. But Stephanie is a health geographer, and she got her PhD at the Faculty of Health Sciences at Simon Fraser University, and that's in Canada. Is that right, Stephanie? So it is a Canadian university. It's a very nice name, Simon Fraser. And you studied in the Cities Health and Active Transportation Research Lab group, which I think sounds awesome. It's quite a mouthful, but I think it actually sounds quite cool. And you finished a postdoctoral fellowship at the Université de Sherbrooke. Is that also in Canada? So is that in French Canada then?
Yes. Yeah, in Quebec.
Okay. Yeah, okay. And you did that in the Urban Health Equity Among Young People Research Lab. You have awesome names for your research labs. I think we should all have like great names for our research labs. So would you like to start by telling us a little bit about the project, Stephanie? Because it feels a bit silly for me to read what you sent me for the project.
Yes, I will do that right now. Should I just start my presentation then?
If you like, you can start now. We've got 53 people in the room, so we've got about half the people who've signed up are in. We don't know if the others will come. I've had a few people saying that they're on the school run. So that's likely UK people, so they might end up coming in a few minutes late. So you might see some additional numbers coming in. And as usual, if anyone has any questions, if you can put them in the chat, and then when Stephanie has finished at the end, I will come to the questions in turn. So you can ask your questions as they're going. Don't worry about that. Just put them into the chat and we'll deal with them one at a time as we go.
Okay, great. Okay, so I'm going to open everything in presenter mode, my slideshows, and you are going to tell me if it's not working. Before. So bear with me for 2 seconds while I set this up. Okay.
So if we can just make sure that everyone else is muted while Stephanie's speaking, so that we don't have any interference.
Okay, how is that looking? Are you seeing my...
So it's still looking, you know, when we first saw it. Yeah, that's it. That's it. Yeah, that's right. Yeah.
Okay, perfect. So you're not seeing my notes, you're just seeing my slides.
No, I'm not seeing your notes. I'm seeing your slides and they are beautiful.
Wonderful. Thanks so much. Okay. So hi, obviously I'm Stephanie, and I was the evaluator for a program that addresses the isolation and health of new immigrants to Canada by facilitating social connection and physical activity through bicycling activities. In 21 to 2023, 3 years of federal government funding enabled program expansion across 3 different Canadian cities, as well as a structured evaluation component. So today I was asked to talk about how I incorporated a realist angle into a traditional government-funded evaluation plan. I was asked to highlight the pros, cons, challenges, what we do differently next time, methodological decisions we took, how we worked together as a team, and how we conveyed our realist methodologies and approaches to government funders. So hopefully you will get all of that and more from today's presentation. So in the talk, I will describe how we augmented our outcome evaluation with a realist evaluation angle. But I'm going to begin with an overview of the Bike Mentor program. Then I'll cover our evaluation approach, questions, and framework. Then I'm going to dedicate some good time to discussing methods, methodological decisions, and the challenges of integrating a realist angle into our evaluation. And then I'll extend that discussion to also cover realist reporting to funders and audiences unfamiliar with realist approaches. And then we're going to have ample time for questions. So I'm going to let the participants describe what was going on in their lives before they joined the Bike Mentor program. So participant 17 said, when I was new to Canada, in the initial days, I was very emotional. I used to cry because I came to this country all alone. No family, no friends. And I was like, oh my God, was it a mistake coming here to Canada? So having this bike mentorship program, it takes away those fears, those feelings of being alone. It gives you the feeling that, okay, you've got friends, you've got people you can talk to, people who are in the same boat. And the program also helps you explore the city. So that also makes you feel that you're not alone. There's somebody taking care of you, who's helping you develop that connection with your community, with your city. I asked participant 12 why she joined the bike mentorship program, and she told me there were 2 reasons. One, that she'd recently landed in Canada as a new immigrant and she wanted to meet new people, or she wanted to meet people. But she then explained the second reason as, I saw there were bike lanes in downtown Toronto, but I didn't have any idea how to navigate them or ride a bike in a new country. And then she explained why this was important. When I first got here, there was only transit to rely on, and I was in the process of getting my driver's license. But getting a car is expensive. It was really helpful to have a bike. Now I don't have to spend a lot of time waiting for the bus. So, having said that, you can see that bike mentorship programs bring together 2 elements. First, addressing the isolation of immigrants through facilitating social connection, and secondly, promoting physical and mental health of participants through physical activity, specifically bicycling, by providing bicycles and developing skills and confidence. So these programs orient newcomers to cycling in the city, encourage social connection, and ideally recruit new people to bicycling. And this is important because, as we heard in the previous slide, when people find themselves in new contexts, they can be more open to adopting new practices. Furthermore, moving to a new country can be challenging, and for many newcomers, health tends to decline after arrival to Canada due to decreased levels of physical activity, stress, and social isolation. The empirical evidence for bike mentorship programs is still being developed, mainly because programs are often offered by community organizations with few resources for evaluation. With the support of the Federal Public Health Agency of Canada, through its Healthy Canadian Communities Fund, bike mentorship programs were delivered and evaluated in 3 Canadian cities, in Halifax, the Toronto region, and Metro Vancouver through 2021 to 2023. And the evaluation was an opportunity to fulsomely assess if, how, and how much bike mentorship programs enhance mobility, belonging, and health. So what happens in the program? The program provides the physical and social resources needed for cycling. Its essential ingredients are that it's a local partnership between an immigrant services organization where newcomers are recruited and a bike advocacy group where mentors are recruited. Newcomer participants are provided with bicycles, locks, helmets, and lights. Participants receive orientation and basic bicycle skills training and are paired with a mentor for 12 weeks. So participants bicycle on their own, with their mentors, and with other participants during organized social rides. And at the end of the 12 weeks, there's a group graduation event. So we can see the program addresses barriers to participation in materials, in terms of know-how, and in terms of community. So the program had been in existence for several years already in Toronto and had been run once in Vancouver before the federal funding was granted. So there were some things that we knew already to guide our evaluation. So what did we know already? We knew from entry-exit surveys from prior years that cycling increased during the program. However, we didn't know if increases were maintained after the program because the exit surveys were typically conducted at the end of the 3-month program period. We also didn't know what the magical combination of program ingredients were. So, for example, one could argue that simply giving bikes to people could increase riding. We also knew that during the program, some participants used bicycles for practical tasks, but we didn't have consolidated evidence about how that impacted mobility and access to resources. We knew that participants met new people during the program, but we didn't have the evidence about how that impacted social connection or indeed belonging. So I had a personal interest in unpacking that black box in the evaluation. A report written in 2017 used photo voice to describe how newcomer participants in Toronto experienced the program. And these findings suggested that feeling at home is linked to familiarity with and comfort in public places and the ability to navigate confidently across the city's landscapes. Local travel is a key component of feeling at home as other knowledgeable en route. However, a German study on a very similar program, based on interviews with 7 participants, found that while participants enjoyed the program, they didn't build strong connections or friendships with the other newcomer participants or with local residents, and that their social interactions were limited to the time that they spent on the project. So lots to dig into. So now that I've provided you with the context for the program and rationale for the evaluation, the next set of slides is going to describe our evaluation approach, questions, and framework to show how we brought together 2 evaluation approaches, our traditional outcomes focus with a realist twist. So how did we arrive at this approach? So the background is that in 2019, the organizations delivering bike mentor programs submitted a project funding proposal to a federal funding agency. And the application process required a fairly substantive evaluation plan as part of that proposal. And at that time, I was a PhD candidate who had been working with both the Vancouver and Toronto teams as part of my PhD research within the city's Health and Active Transportation Research Lab at Simon Fraser University in Vancouver, Canada. So my PhD topic looked at soft bicycling training interventions and behavior change. So while my PhD research wasn't looking at the bike mentorship project per se, I was familiar with it, and I was familiar with the people involved. So I was asked if I would write the evaluation plan for the funding proposal, and I agreed. I was already curious about realist evaluation. I had been previously thinking about incorporating realist evaluation into my PhD research, but ultimately had decided to go in a different direction. So the bike mentorship evaluation proposal was an opportunity for me to to learn more about realist evaluation, and also to think about how I would pitch realist evaluation to others, as well as to funders. So while the evaluation proposal template provided by the funder was very geared towards behavior change, outcomes data collection, and analysis, I crafted part of the evaluation plan to examine how the program would facilitate its outcomes. And I went back to the application and saw that I wrote, "It is the close scrutiny of causal mechanisms that provides insights into what makes effective programs work, and thus what essential program aspects will need to be replicated or adapted for new contexts." So I pitched realist evaluation in service of program scale-up, which makes sense as the program was going to be delivered in new locations. So from the onset, our evaluation plan proposed a combination of an outcomes-based evaluation with what I'm calling realist-inspired or realist-light evaluation. So I like to describe our evaluation to non-realist audiences as having two purposes. So the first, to assess if the program works. What changes do we think the program will facilitate, and how do we measure those changes? And to assess if the program worked, we built on previous evaluation work and indicators, and we used multiple methods, both quantitative and qualitative, including questionnaires, trip journals, and interviews for our assessments. The second purpose was to unpack how the program worked. Specifically, we wanted to map out the pathways and describe how the program helped to facilitate these pathways so that the program could be replicated in other places where contexts might differ. And this is where we took a realist evaluation approach to assess how the program worked. And again, we used multiple methods, including those already mentioned, plus additional staff workshops. So we had 4 evaluation questions. The first asked if, how much, and how the program results in an outcome. So the first being, to what extent and how does the program increase bicycling participation for different purposes and to prepare participants to maintain cycling after the program ends? To what extent and how does the program enhance belonging for participants? To what extent and how does the program enhance health for participants? And the fourth question asked, what are transferable best practices for sustainability and scalability of the program? So we adopted this evaluation framework, stressing the iterative phases of developing, testing, and refining program theory. And because of the proposal process, we'd done some work already developing our interim program theory and identifying outcomes of interest. So the developing theory and testing theory phases aligned with our funders' expectations. So here, the realist and outcome approaches complemented each other. I couldn't fit this timeline into the previous slide, but I wanted to give you a general idea of how the proposal and project timing unfolded, and I'll be returning to different parts of this timeline in the next few slides. In terms of developing theory, the developing theory phase, a lot of work had been done before and at the evaluation proposal stage to develop the initial program theory. So I was already aware of academic work being done in Toronto that I could build upon, And I worked with the Toronto and Vancouver program managers to ensure the logic model, and especially that the program outcomes and indicators reflected in the program would meet organizational needs. When possible, our indicators drew on measures used by Statistics Canada to enable comparison between program participants and other populations, or with measures that we had already used in previous program iterations to enable comparisons to earlier programs. And this work was required by the funder, so it served the needs of both our outcomes-focused and our realist evaluation approaches. And at later points in the evaluation timeline, I would circle back and revise the initial program theory, which is a step you probably wouldn't do in a normal outcomes evaluation. So we had about 2.5 years to conduct the theory testing phase. Data collection and analysis, especially surveys, trip journals, and interviews, were used to answer the outcome evaluation questions. There were 3 cycles of data collection involving surveys and trip journals. The data monitoring, analysis, and discussion occurred on an ongoing basis, so there was continuous team discussion. I'm skilled in mixed methods and as well as in quantitative data cleaning and analysis. So I was able to update and strategize with staff to ensure comprehensive collection and response rates, as it was the staff who had direct contact with participants. So it was really a team effort. In year 1, 2021, we could already see some patterns in data and where we needed to augment or revise some of our data collection tools. I also was a very involved evaluator where I attended events in Vancouver, and I heard participant stories at graduation events and realized where we might be missing things in our program theory and hence in our survey questions. And one benefit of the interim reporting requirements set out by the funder is that it forced us early in the process to assess whether we had the data to answer our evaluation questions. I used qualitative methods to refine our program theory, namely participant interviews and staff workshops, which will be discussed in the next slides. So the theory refining aspect to the evaluation definitely added an additional amount of work, not just in data collection and analysis, but also in reporting the findings. I found reporting the findings to actually be the most challenging aspect, and it's an area I'd like to improve in future. And I only needed to present the findings pertaining to like our theory refining work to the team internally during the project, but I didn't have to do this in any formal interim reporting to the funder, for better or for worse. So the next section, I'm going to delve into the interviews, staff workshops, and data analysis in more detail, because I think this will be of interest to you. So I used interviews with newcomers to both better understand outcomes, and particularly for understanding access, belonging, and health, and for refining our program theory. So I provided examples of the types of interview questions that were outcomes focused. These interviews were conducted on Zoom 2 to 12 months after program completion. I had also the participants' survey results, so I was able to use a maximum variation strategy to capture diverse perspectives. So initially, I sought representation from all program sites and I randomly selected participants, but later I used a different strategy where I identified participants who reported comparatively lower belonging or self-reported health, or who hadn't bicycled since the program ended, to more fully understand what was happening with these participants. I also used realist techniques in my interviews. And as you know, in realist interviews, the subject matter is the program theory. So theories are placed before respondents for them to comment on for the purposes of confirming, denying, and refining the theory. And this can be summarized by Ray Pawson's phase, I'll show you my theory if you show me yours. And this was something I really embraced. So one example of a realist question I asked was, we have a few different ideas about how the program works for most participants. One of these ideas is that the program opens up the city in new ways for participants. Was that your experience? And this was the jumping off point for us to have a discussion. So realist interviewing was a learning area for me. I already had qualitative experience, but this is involving some new skills and some new ways of developing questions and prompts. And I really relied on online realist resources as well as webinars. So shout out to the Realist Hub that were very helpful for me to develop and revise my interview questions. And there were multiple revisions. So I'm going to move on to the staff workshops, and I'm going to spend a bit more time here because I think this might be of particular interest. So I met program delivery staff regularly throughout the program season, but when the season wrapped up, each year, we set aside time to come together on Zoom to explore learnings and best practices within and across program sites and for deep thinking to refine program theory. So in total, there were 2 post-season debriefs and 2 theory revising workshops. So to prepare for workshops, I provided staff with homework to complete ahead of time. Staff also had access to survey, trip journal, and interview findings. So I would prepare these high-level summaries, as well as mentor exit survey data, as well as previous staff workshop results if we had them. So this was an iterative process, or I would say that it was an iterative process between staff workshops and participant data collection. And particularly with with the interviews. The theory refining workshops helped me identify areas for further probing in future interviews, especially where data collected from participant surveys and trip journals weren't or couldn't provide the rich insights into outcomes or mechanisms. And later, I would take some of the findings from the interviews and bring them back to staff. So in summary, I used the theory refining workshops to revise mechanisms, to identify context, and to identify evidence gaps. The post-session debriefs were more focused on actual program delivery, which was also important for me to understand differences in program delivery across sites. So our first theory revising workshop was held in January 2022, and here are some snapshots from the Zoom session. So as I mentioned, I assigned homework for staff to complete in advance, which we then discussed at the workshop. We had a Google Drive, or I set up a Google Drive for project evaluation, and there was a folder devoted to the staff workshops. So in advance, I would compile the homework responses and put them in the Google folder. I also transcribed the sessions and I put those into the folder. So staff had access to this at any time. And the staff theory workshops were helpful for not only allowing me to learn from their knowledge, but also for training and onboarding new staff in realist thinking, for getting buy-in into the process, and for allowing us to drill into the similarities and differences across program sites. And staff also said that they learned a lot from each other and that they found the workshops to be inspiring and really gave them a renewed sense of energy. So here's some snapshots from our second theory revising workshop in January 2023, a year later. In retrospect, I would say there were definitely some limitations to my ability as a facilitator in being able to focus staff energy on CMO configurations. There were a lot of them. And in the end, I tried to simplify by identifying some of the major ones instead of all of them. And I think this is an area where I could have benefited from chatting with another realist evaluator or having someone else on the team. It seemed that, well, I definitely found that reviewing the CMO configurations was not a good use of precious staff time, so I abandoned that. Another area we struggled with was context. Like staff understood the importance of context. They really got it, but context can be like huge. So to narrow context, I tried to focus on conditions that seemed to change how or why the program worked. And then we tried to ask ourselves, in what specific situations does this mechanism work or not? And that turned out to be more productive. So the staff were an absolute goldmine in terms of their knowledge about context. Staff who'd been around for a few program cycles were just brimming with insight. They were able to compare context across years. And one challenge was that there was some staff turnover, especially in year 3 of the project. And yeah, I definitely felt this. There were also some limitations in my ability as a facilitator to scope context. And again, this is an area where I could have benefited from chatting with another realist evaluator. So for example, like I tried to create workshop questions like, when does the program work best? Or what kind of participant thrives in this program? But we found there was just so much variation in the answers. And when we tried to make generalizations or abstract the variation of responses to a higher level, then we kind of lost some of that explanatory power, or the context descriptions just seemed kind of bland and trite. Yes, I'll talk more about this later if there's questions, but I just want to say that furthermore, in our context discussions, so much context pertained to like individual and community needs or to challenges or opportunities posed by the COVID pandemic, or to socioeconomic conditions or to program delivery constraints, that in the end, I had to make decisions. And I decided to focus on what seemed to be the most relevant contextual conditions that were clearly articulated as influencing mechanisms. So I think this is part of the sort of pruning and editorial and crafting our story piece that comes with ultimately how we present our findings. I also facilitated sessions that I call post-season debriefs that were less explicitly theory-focused, but more focused on actual program delivery and on sharing strategies and learning from each other. And this was absolutely essential to do in the fall of 2021, which was our first year of program funding, as the program had been funded quickly in the summer months, and each site had to get up and running in order to be able to provide any sort of programming that year. So there were a lot of things to organize, as you can imagine, hiring staff, getting bikes, recruiting participants and mentors. And it was a bit of a scramble because the bike-friendly, dry and warm weather season is short in Canada. Program staff, as I mentioned, were very enthusiastic to learn from each other. And these sessions, although not labeled theory revising, were also important for me as an evaluator. So for example, an early exercise assessed program fidelity by uncovering differences between the way that programs were delivered at each site. So as expected, there were differences resulting from necessary adaptations to the program due to participants being sick with COVID, or there not being enough bikes due to supply chain issues, not having enough mentors, participant mentor mismatches due to distance and people's schedules, etc. So I guess in summary, the sessions with staff were well received, and what worked well was engaging with program staff in ways tailored to their needs. So setting limited and realistic numbers of hours each year and scheduling them during less busy periods by asking staff what would be of value to them and designing activities around these requests. As I mentioned, abandoning CMO configurations and instead treating CMOs as a heuristic concept, and ultimately focusing our attention to flesh out the change mechanisms that were least understood. So in terms of my analysis method, after each interview, I uploaded the recordings to an AI transcription service, and then I reviewed each transcript while listening to the recording to correct major transcription errors. Also, immediately after each interview, I wrote a summary to reflect on learnings, and each summary included like the big idea, any surprises for me, the top 3 learnings, and things I wanted to explore further. I also wrote the section of like what I could have done better in future. And in terms of how I coded the data, I did this in vivo just because I had a subscription and that's the system I'm familiar with. Early rounds of coding involved identifying mechanisms, and I defined this by thinking about activities and resources provided in the bike mentorship program and those participant reactions to them. The next step involving categorizing these mechanisms and looking for similarities, patterns, and outliers while mapping the facilitating circumstances. And I want to point out that it was only me scheduling, conducting, and analyzing interviews. And so given these resource constraints, I had to make some pragmatic decisions about how to code and analyze the data in a way that would still be rigorous. So initially, I tried to do this very detailed coding to construct the CMO configurations. And eventually, this kind of became unwieldy. So I sought guidance from realist evaluation articles, webinars, and blogs about how to simplify the process. And the first decision I took was to narrow my focus to a handful of key mechanisms and contexts that were the most relevant to our research questions. And also for practical purposes, I I really tried to keep interviews to 30 minutes, which meant a very streamlined interview schedule. My second approach was to use multiple coding passes and to rely heavily on memoing. I would do this anyway, but in this circumstance, I used a lot early on. I started using a lot of tables to group and compare mechanisms. So you can see a little example of like one row of a table. I used a lot of I used these tables to group and compare mechanisms, participants who described a particular mechanisms, to keep track of illustrative quotes, i.e. my evidence, and then what seemed to be the facilitating context, to try and figure out why some participants experienced this but not others. So this quickly ballooned into a lot of information, and I opted to write it up in a narrative description rather than trying to wrestle all this information into a table or visual in the report. And it's another reason why I call my approach realist light. If I had more resources, I would have streamlined and prettified these analyses for readers in a report appendix. My third approach was to engage stakeholders for validation. Again, I would do this anyway, but it just fit very well within realist, like the realist methodology. So I floated my findings at staff workshops and in participant interviews, and this helped ensure the findings were resonating. And I could also use the interviews and workshops to further explore what seemed to be contradictory findings. And again, this is something like I would do as a mixed methods researcher, so it felt very apropos to do it for this evaluation. I wanted to keep the final evaluation report concise, and I asked for early feedback on report drafts. And the feedback I got was that my readers recommended more high-level summary of interview data and less detail, understandably. So I thus made some pragmatic decisions in service of readability and concision. So first, what I did was I prioritized the findings with highest explanatory value for the program theory. These were the contexts and mechanisms that seemed most relevant for explaining why and for whom the program worked. Second, I tried to use quotes strategically as illustrative examples. I also sought to summarize broader trends in interview data to demonstrate consensus or divergence, which entailed dropping some quotes. Third, I decided to eliminate the CMO mapping. Feedback on early report drafts found it too jargoning and hard to follow, and just told me they didn't actually find that much value in it. So once I made the decision to eliminate this, the report became more readable. And maybe this was a decision for better or worse, but as I said before, it's another reason why I call my approach realist light. Next, I leveraged the strength of my mixed and multiple method data to triangulate findings. I could show how findings from interviews aligned with other data sources. And then finally, I tried to write for my audience by using descriptive headings to summarize findings. And this helped me organize my findings while reinforcing their relevance to program theory, which helped to keep the qualitative findings more focused and concise. And yeah. I don't think any of this is like magical. These are not magical things. I think they're just generally best practices for reporting qualitative data and report writing. But there you go. So the next section is going to touch upon how we communicated realist methods and approaches. So there was a lot of reporting throughout the project. There was the interim reporting I did for the program sites. And then there were 2 interim evaluation progress reports for the funder, where I had to use their progress report formats. And so here for the funder, I reported on outcome indicators, i.e. changes over the program and at one-year follow-up. And I reported on program theory activities, but not really on the findings. Fast forward to the final year of program funding, where written findings were shared in 4 main documents. So there was the final written report written for funders using their report format, which isn't publicly available. And again, the data reporting here was on like participant reach and outcome indicators. And there was really only one place in the report format to discuss any of the realist findings, where we were asked to provide a summary of any other evaluation findings for your project beyond those that are reported as short, medium, or long-term outcomes. Describe any unintended consequences. So here I just directed the reader to the final technical report because, yeah, I had a lot to say about this. I then created a technical report for the following audiences: our funder, the program sites, so that they would have evidence for future funding applications, for future bike mentorship program evaluators, and finally for other interested readers. And I was really thinking about my participants here. So this final technical report is 29 pages long, not including the executive summary or appendices, and it's available online. There was also a pretty colorful executive summary, which we created primarily for future funding applications. And there is no mention of realist evaluation at all in the executive summary. So the links are there. You can look at these if you like. And then we created a best practices or how-to document that is focused on program delivery intended for current and future program sites. This program drew heavily from the program staff workshops and actually it answers our 4th evaluation question. I was also invited to present our evaluation findings to our program funders peer network. So this included staff from the Public Health Agency of Canada, who was our program funder, and to their other grant recipients. And when I was asked what might be of interest in this presentation, I was advised to go heavy on the findings, meaning our results, photos and quotes, but to also touch on realist evaluation, as the information might be helpful for the new project cohort starting to work on their evaluation plans, and that staff from the Applied Research Division might also be curious to hear about it. So I thought it might be of interest to this group to see how I incorporated our realist findings pertaining to program mechanisms into that presentation. So just super quickly, I had 20 minutes for my presentation. And as you'd expect, I started with describing the program context, then the evaluation questions, and then I provided some some information about participant characteristics. I then presented findings to answer the first 3 evaluation questions pertaining to bicycling, belonging, and health. So I describe in this slide the data that we use to answer evaluation question 1. And then I presented findings on the outcomes. And then I briefly talked about how we thought this happened. So really, I'm just very briefly describing the program mechanisms that increase bicycling, but you see that these are decoupled from context, so they're really just lists. There's kind of only so much to say in 20 minutes, and so what I would do is I refer to my final report for more detail. I use the same structure for evaluation questions 2 and 3, and sometimes I would offer like a quote as well to illustrate things. So you can see, I just followed the same structure for the following outcomes. So yeah. And I did describe a realist approach in the presentation. I explained why we used a realist approach. I sketched out how we did it, and then I referred to our final report for findings and for more details. And I described our methods. So you probably remember this slide. It was initially created for the funder presentation earlier this spring, and I've repurposed it for today. And you'll probably also remember this slide, as well as this one. And I invited the audience to ask questions about our realist approach, but there were no questions. So yeah, I don't really have anything to offer you today about what they were curious about. There were a lot of other questions, but not on realist evaluation. So I've talked about our evaluation approach and framework. I've described our methods, decisions, and challenges, and I've summarized how we communicated our realist methods and approaches. So now I'm going to turn it over to you for your questions. And before I do that, I just really want to acknowledge all of the people who were involved with the project and the evaluation. So over to you, and I will stop sharing my screen.
Thank you so much. Thank you so much. That was actually I'm so pleased. I really missed these. I don't know if anyone else realizes, but I'm quite a methods geek. So I really do love these, and I don't think I realized just how much I'd missed my fix of hearing about other people's studies until you started talking. I've written loads of like ooh notes. So if no one else has any questions, I could occupy you for a couple of hours, but never mind. So in true realist hub style, can we please just turn on our cameras and our microphones, because if Stephanie had presented in a lecture hall, we would be giving her a nice round of applause for that fantastic talk. So can I please encourage you to show a bit of collegiality, and we'll give her a big thank you. Thank you very much. Although I think there's only me clapping because everyone's on mute, because obviously everyone obviously doesn't like the sound of their own hands coming together. I think that must be it. And I still don't know. So I see these clapping hands. I need someone to actually show me where's the clapping hand bit on Teams. I see these virtual ones and I don't quite get it. So if you've got any questions, put them in the chat. There's a couple coming through. I mean, Stephanie, you've touched on so much that I think will be relevant for PhD students coming through. There's so many things that we could pick up on, but I think one of the things that resonated with me when you were talking was around realist interviewing. Now, as an experienced mixed methods researcher, you obviously, I'm assuming, would have had experience in doing qualitative interviews prior to this. So some PhD students have no experience. So that I think creates other challenges. Now, I'm a chartered psychologist, so we are taught through our training to ask questions in a particular way. And for all you psychologists in the audience here, that's not the realist way. So a realist way of asking a question can be very uncomfortable for psychology students. How did you, and I'm not saying you're a psychologist because you're not, you're a geographer, but how did you cope? Or cope, I don't know if cope's the right word. How did you find asking those more direct questions, sharing those like program theories, like ideas, which is exactly what I did. I phrased them as ideas.
Yeah, I mean, I kind of had, first of all, I guess, you know, I guess I was always a little bit worried that I was like leading the participant, I guess, or that, just that whole idea that you're putting ideas into someone's head. And I think what I tried to do is be very clear in my information letters beforehand to participants about the purpose of the interviews, really being clear that, this is going to help us improve the program. I also, in my little, in the interview itself, really tried to encourage respondents, my participants, to disagree with me. I really, really tried to make it very clear to them. I'm like, you have so much to offer. You're the one with the experiences. I'm going to learn so much from you, and really tried to also say, please disagree with me because this is important.
Yeah.
So really just try to, say there's no right or wrong answer here. And this is, it's a conversation.
I agree.
Mm-hmm.
And I think one of the things that I think, which you sort of touched on here, is that there is a relationship that you need to have between you and the interviewer and the person that you're interviewing, which our healthcare colleagues in the audience will be familiar with because they have to have a therapeutic relationship when they are in their context of caring. And I think if you can use the principles of that within your interview, because you're trying to develop a rapport because you want them to open up. And I also think it's important to maybe just make the distinction for those that are especially new to the method. There's a difference between leading and being direct. And in realist research, I'd say we're very direct with our questions, do this direct sharing of ideas. But it goes against the grain. I have to say, when I first did my first couple, it's really, really uncomfortable. It's like, oh, I wasn't taught to do questions like this. It just feels wrong. It takes you a little while before you settle into your groove. So I've got so many more questions I could talk about, especially about the workshops and involving staff. So I think there's something that we could do with around co-production. I think we could do with a session around that because I think that's quite important. But I'm going to go to the first question. Gail Mann, do you want to ask your question, or if you are struggling, don't have microphone or whatever, I can ask it for you. But if you want to come on, ask Stephanie yourself, then you're quite welcome.
Yeah, no, I can ask. That's fine. Yeah,
Perfect.
Thank you. Thanks, Stephanie. Really interesting presentation. I work for a local authority in a public health team, and we're sort of looking at realist evaluation and how to apply it in kind of more pragmatic ways in terms of trying to inform what we do as we do it. So my question is really about how the learning from the evaluation kind of feeds back into the program and continues to inform how that program is designed and delivered. And as part of that, the extent to which the participants are engaged in that kind of co-productive way, do you think that involvement of the participants and the way that you involved them, I suppose, tapped into their evaluative and critical thinking in order for that culture almost of thinking to stay with the program development in the future?
So I would say that
Great question.
I guess in terms of thinking about how does the learning feed back into the program, what was really lovely about having these explicit theory revising sessions and sharing sessions is that it was really dedicated time that was very much structured around what are the things that other sites are doing and how can we learn from each other and what worked best, and the actual program staff would take away ideas and then apply it at their own site. And then we were able to come back and find out that, how well did this work or not. And also, I think that, it really also, like, there were some sort of philosophical types of questions as well that really forced us to think about, who is this program serving? How are we reaching those who might need the program the most? Really talked about what we're able to do within like resource, constraints. Like in terms of the people who received the intervention, the newcomers, I would say that for some of them, it was their first introduction to research, but a lot of them, like they come to Canada as part of this program where they're often very highly educated. A lot of them were already had research experience. So they were super keen. They wanted all the details. So like they were definitely an audience that I thought of when I wrote my report, being like, oh, what would so-and-so think about some of this? And the staff were great at the very onset. We actually, in the sort of program orientation, or one of the program sessions, there was actually a little thing about research and like, in Canada, what are your rights as a participant? And this is how you're, like, we had to be very clear about what the evaluation would require for them, in terms of, we're going to be asking you to complete all these surveys, and we're asking you to complete a trip log every week, and the staff would follow up with participants if we weren't receiving those things. So it was a way too for, I think, staff to be checking in continuously with participants, because there was the structure where there was like a program manager, and then there were these mentors who kind of had a lot of the direct contact with participants. So in a way, it's almost like the evaluation kind of also became a little bit of the program delivery, which was really interesting, because I would say the like data collection tools also maybe became a bit of a mechanism in themselves, in terms of like, oh, I have to do this weekly reporting that makes me reflect on how much, what I actually achieved this week in terms of my biking. And so participants said, oh, the weekly trip reports actually had me start tracking things. I went out and I got like one of these watches, and I was so amazed by what I actually accomplished during this program. And so there was like a little bit of an unintended, I say consequence as if it's something negative, but there was an unintended effect, I think, in terms of like, oh, yes, that's something we need to consider. So,
I mean, I think it sounds like your evaluation needs an evaluation of its own. Because I think one of the things we don't see enough of in the literature yet, I think, is that longer term impact of either a review or an evaluation, and where it's managed to lead to. Now, we had, when I was running Nuts Realism, Thomas Morton delivered a talk for us, and then he came back and did a Realist Hub one for us. And that was like the second iteration. But there's not very many studies that we see that go on. And I'm hoping that will change, so that we can get more of a longitudinal understanding. And especially, as you've mentioned, I think it's a fascinating question, Gail. What is it that we do? We talk about having research champions in research. And does this, in effect, instill some of that within the practitioners to give them that like motivation to keep it going? Yeah, I think it would be an interesting analogy. So if anyone knows of any research, I don't have anything off the top of my head, but if anyone does, please feel free to pop it in the chat, because maybe we'll try and get them on and they could do a talk and tell us all about it. But does that answer your question to Stephanie, Gail? Brilliant. So we'll move on. So yeah, we've got a few fascinating. So we've got a few love for you in the chat there, Stephanie. But I think Daniel's got the next question. If you want, Daniel, you can come on and ask your own. Although I think I'm reading Daniel, but I don't know if it's Dan. If you prefer Dan. Yes, I can. So you can let me know whether you're okay, fine. Yeah, see, I'm a Joanne, but I don't respond to it. I only respond to Joe. So if you call me Joanne, I'll ignore you. Fantastic, sorry, presentation, completely misread that. Thank you so much. Do you have any recommendation for useful realist resources in the early stages of the project? And or any tips for making the difficult decision to scale things back with the resource limitations? Oh, so you could be in one of the PhD supervisions that I do. So yes, we don't have the resources of the world at our fingertips.
Okay, in terms of useful resources in the early phases of the project, maybe I'll just tell you about my journey. So I started by hearing about realist evaluation. I sort of heard about it here and there, but there was a realist conference, or sorry, there was an evaluation conference in Vancouver, and one of the people who asked a question in the room was Justin Jagosh from CARES, and I actually ended up having Justin mentor me as a PhD student, which was really helpful when I was still thinking about whether or not I was going to do the, incorporate a realist evaluation piece into my PhD. My PhD was huge. I had to scale back some things. So, that is like basically why that piece got dropped. But I also read I read some of the classics, right? I read Realist Evaluation by Pawson and Tilley, which is really hard to get your hands on a hard copy of that book, actually. But I just, that was a good reading. I think it seemed like I just sort of read a lot of so many things as I could. I just tried to read a lot of things. I found the listserv, gosh, I forget what it's called. You all know what I'm talking about when I talk about the listserv.
The Ramesses, the
yes,
mail. Yeah.
So helpful, like really, really helpful. I want to shout out, I don't know if she's still here, but Maura from UBC
my friend Maura,
yeah, she had a she had a workshop at UBC that was also super helpful. I would also say like some of the webinars, the free webinars were just really, 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 really helpful. Blog postings from practitioners were really helpful. But in terms of designing things, which is probably what you're asking about in terms of early phases of the project, yeah, that was something I probably, I can't recall. Sorry. Yeah, I'm stalling. I can't recall.
I'm currently trying to look up resources on Amazon, so if people haven't read them, they can find them. So this might be a good point to just ask in the chat, because I think there's probably enough early career researchers and PhD students left. What would help you? What would you want to know? Because, I chopped a chapter at the end after it was written, because I didn't have enough room for it. So that's uncomfortable to, to do, because of all the effort that you put into collecting the data, coding the data, analyzing the data, synthesizing the data, making it link with all of the other chapters that you've got, and then to drop it at the end. So focusing your projects is really important, and it's something that when we're working in postdocs you have to do, because your deadlines are hard. So you have to focus. It can be hard to try and work out how to focus when you don't have enough resources. I get quite brutal these days, I'm sure my colleagues would say. But if anyone wants to put anything in the chat about what they think might help them, then that's something that we can try and organize for a future session. And by all means, if this comes to you later, just email me at the Realist Hub at Aston, the address that you've got, so that should be fine as well. So do we have any more questions? No, but lots of love. So I'm going to go back to one of mine, if that's all right. So I was really interested. I'm trying to do quite a bit of work at the moment, Stephanie, around co-production. And I was really fascinated by the workshops because I think trying to find innovative, non-static ways of bringing people along this research journey with us, especially when it's online, is quite challenging. And we've employed a variety of techniques. When we had in one of our old research, I used to sit and have coffee, virtual coffee and cake before our meeting and get to know people. And we've used murals, like online post-it notes. What tips would you give out anyone who's trying to help in that space? And then again, I think there is an element of they need to see the person. For you, it's a bit different because they're your staff members. If they're not staff members, they still need to see the person, I think, not just the researcher. Got to see the person behind the research to help them open up to you. But teams can be challenging to get meaningful engagement.
Yeah, I mean, I really was like, oh, should I do one-on-one interviews with people? Should I do group interviews? Like, I think the focus group format, I mean, I don't call it a focus group format, I call it a workshop, but bringing people together was really great because it just kind of served many purposes, people could learn from each other, and that was such a huge desire. But also there was that interplay where people would agree or disagree, that kind of richness that the group interaction that you don't get in a one-to-one interview. There was no way.
Pros and cons, isn't there, to groups and individual interviews?
Yeah, definitely. There was no way there was going to be any like group deep theory session happening in the early phases of the project. Like that's a reality, right? I mean, in my perfect world, we would have started with that, but
yeah, I think that is something that's quite important. I mean, Ray Pawson said many times that the CMO, or the MCO, as he's now sort of maybe categorizing it, is just a heuristic and you do not have to use it. But I think as PhD students and as early career researchers, if you're new to this method, you kind of want something to hang your hat on, and so you tend to gravitate towards this CMO configuration. But I think sometimes you can end up getting bogged down in the detail, and I think it's maybe trying to get people to understand that it's more about, like you said, the concepts. What can we do to change? It's maybe take that step back at a more abstract level. What is it? Eyes on the prize. What are you trying to do? And I think that might help people to work that out. Yeah.
Oh yeah, I was losing people with I was like, okay, sure. Those configurations, that's my work. Nobody cares about it but me.
Yeah, I mean, it's difficult. It's the first lived experience group I did, my very first one at my PhD, and I was told, keep it simple, blah, blah, blah. So I did that. And I said, this is realist research, and this is what we're trying to do. Don't worry about it. And the very first question that came from one of the lived experience people was, so Jo, this realist research, how does that differ from Bhaskara's critical realism? Well, I practically fell off my chair. I now supervise said lived experience researcher in their project, but that I wasn't expecting that at all to come from the floor. So I think you do have to be aware that you have to pitch it at different levels and be aware that you can have, but I think a lot of the time people just didn't want to know about the CMO thing. They just want to know what the headline is. What is it you're trying to tell me? You don't need to make it as a context mechanism outcome for me, but you need to have those elements within whatever it is you're telling them. You just don't need to explicitly say, this is the context.
Quite often say, okay, let's think about our intervention in terms of a recipe, and we have all of these ingredients, and we need to think about like how we might adapt this recipe in, so we kind of use some other language, and yeah, we kind of revisited some of these things over and over again, like what is the purpose of this particular activity? What would happen if there was I was a little bit obsessed with this idea of like, dosage, like what is the appropriate number of meetings there need to be, you know, blah, blah, between like a mentor and the participant for this to have the most effect. And yeah, I don't know how.
Agree.
I didn't get, you know, there was no another evaluation, I guess. I'm not sure. I see there's a question from Gail that popped up exactly while we were having this conversation. So
Hi, yeah, I was just thinking about when you were talking about the kind of co-production side of things. I was thinking about reflecting back on what you said, Stephanie, about the realist interviewing, and how that approach kind of democratizes the research process to some degree, and enables a sharing of power if you do it in the right way, I guess, which means that participants kind of own their own experience, and that enables them to refute some of the things you might be saying about, so and if you give them the opportunity to, by saying, oh, I might be wrong about this, but I'm interested in your experience of this particular program theory, then it's a really nice way, I think, of rather than, you know, an interview participant being on the receiving end of your questions for your research. It's yeah, I just wanted to make that comment, because I think that that's something that we found good for kind of group learning as well.
So I don't know if anyone else has any more questions. I mean, I could just talk to you all day, but that's just me and realist research. I can do that. But it is, I mean, it's getting on here. It's just like tea time if you have children. Over here, what time is it where you are, Stephanie? How many hours behind are you?
8.
Okay, so yeah, so you're the same time zone as Maura then. So it's like, what's that, 9:30 now? So you started this 8 o'clock in the morning. That requires a certain level of respect, I think, to be able to get up and function like that at 8 o'clock in the morning. I'm not sure I'd be so great.
For jet lag.
Yeah. Well, okay, fair dues, because you were in the UK recently, weren't you, visiting? Yeah, fantastic. So if anyone has anything they want to ask, please do so. I will stay on this call, so if anyone has any questions, I always think that sometimes you spend months, as I did, months and months and months trying to work something out that somebody else could have told me in 20 seconds. So if you feel like that's you, then yeah, please hang on, and I'm sure we can help you get to the bottom of any of the questions that you've got. But otherwise, unless there's anything else we need to say, I think we'll say thank you very much, Stephanie. It's been brilliant. We